Hi, I'm Marc Gorelick, President and CEO at Children's Minnesota, and I'm here today with Dr. Tom George. Tom is the System Medical Director for Neonatal Care here at Children's Minnesota, and he's here today to help us learn a little bit more about prematurity. November is Prematurity Awareness Month. So Tom, thanks for being here today.
Thank you, Mark. It's a pleasure to be here.
I know that prematurity is one of the most common reasons for babies needing neonatal care, and their needs can be quite complex. So you can tell us about some of those highly specialized, complex services that we provide here at Children's Minnesota for those what are often very fragile babies.
Indeed, these are the most fragile and tiny patients that we care for at Children's Minnesota. The way this complex care is delivered is by a collaboration of team members on a day-to-day basis rounding at the bedside, and that involves the bedside nurse, nurse practitioners, the neonatologists, dietitians, pharmacists, and of course the family engaged in planning the care of that baby that day. Additionally, what we know that babies born prematurely can face are medical or surgical complications. And what we have at Children's Minnesota is a fantastic team of every possible medical specialist or surgical specialist that babies born prematurely might need. And that is something that babies who are born prematurely have to have access to.
And I might add that we at Children's Minnesota, we are recognized as a level 1 surgical center by the American College of Surgeons, and being level 1 means that we're able to provide that surgical support for all children of all ages, including the youngest premature infants, and that's a kudos to that team for that recognition.
Indeed.
One of the things I've always appreciated about pediatrics is we often put an emphasis on trying to prevent problems in the first place. Can you talk a little bit about what we know about the causes and risks of prematurity and maybe some of the efforts that are going into preventing it?
Yeah. So what we know about prematurity is that we haven't made a lot of progress over the last decade. The rates of prematurity have stayed pretty consistent in Minnesota. And while we get a grade of B from the March of Dimes, while that may sound good, actually when you dig deeper into it, what we have uncovered is that there are issues related to systemic racism that have uncovered factors that probably impact babies in ways that we are just beginning to understand. So while there might be individual factors, for example, maternal diagnoses that may increase her risk for having a baby born early, if we can really get to the bottom of some of the community and societal issues that clearly impact the outcomes of babies born prematurely, I think we'll have even a bigger impact on affecting the rates of prematurity and the outcomes of babies born prematurely.
I think you alluded to this earlier. One of the other things about pediatrics is we know that babies don't exist in a vacuum. They're part of a family, and their needs are not just medical. You pointed out that some of the causes of prematurity are not just medical, but societal and emotional, and certainly the needs of patients and families. So can you talk a little bit about how we address the whole needs of the infant and the family in our neonatal care?
Absolutely. So at Children's Minnesota, we have access to every possible need a baby and family may have. And getting babies to a better place, getting families to a better place, so ultimately they're able to take their baby home, involves the care that is provided in a way that supports the family on this journey that these babies are on. That involves social workers who can help families deal with the emotional toll that having a baby in the neonatal intensive care unit takes. That involves many other specialists, including therapists, physical, occupational therapists, that help intervene and support babies in making developmental progress toward getting those babies home. And when babies have medical or surgical needs, that's the other part of Children's Minnesota, that we have access to every possible specialist that a baby might need in their journey that sometimes can be up to several months at Children's Minnesota.
Tom, you see this every day, but one of the things I always appreciate when I go around in the NICU, I walk down the hall and I see the pictures of the kids who've been in the NICU and the pictures of them now as older kids and grown-ups. And I know we're one of the largest neonatal programs in the country. There's a lot of lives that we've touched here, and a lot of young folks and adults in this community that are NICU alums, as we like to say. Mm-hmm. You must have the opportunity to sometimes meet them or connect with them in some way. Tell me what that feels like.
In our NICU follow-up program, both in our St. Paul and Minneapolis sites, we have an extensive program that monitors them for years after they graduate from the NICU. We continue to hear from our families. They keep in touch with us and send us photos of their children as they grow up. I just got a delightful photo of a baby Yoda, of a baby who was born 18 weeks prematurely, and was just a joy to receive. So you're absolutely right. When we get to see these babies and families, and as they grow up, that really drives home the point of the why. The why we spend all of that passion poured into our work at the bedside is when that baby does weigh less than a pound, we know that the potential that that baby has is what drives every one of the team members every hour of that day.
Wow. You've described huge team, complex system of care. A lot of resources go into that. I know that that kind of care we're able to provide partly because we do get generous support from the community and from our generous donors. Can you talk about the importance of that?
Absolutely. So highly specialized care like this is only possible in part because of donors we have in the community. There are many programs in the neonatal units that are supported by philanthropic gifts from the community. Examples of those are the We Read program, which purchases books and encourages families to read to their babies in the newborn intensive care unit. We have cameras that allow access for families to watch their babies, even if they're physically not able to be in the unit for whatever reason. They're able to log on remotely and see a live feed of what their babies are looking like and what they're doing. The most recent example of a philanthropic gift is one that has led to us, in partnership with the March of Dimes, recruit a family support coordinator. This person's role is going to be to develop, implement programs that'll both help staff as well as families in their journey. And we are really excited about this new role.
Wow. Well, you know, there's the old saying, it takes a village to raise a child. That's got to be especially true for raising a premature infant. And certainly those community supporters are part of that village. And of course, at the core of that is our incredibly dedicated and talented teams that you lead. So appreciation to all of them for the fantastic work they do taking care of those babies here in the NICU at Children's Minnesota. And thanks to you, Tom, for being here today to talk with us about it.
Thank you for the great discussion and for your support.